I'm Kelly Worthman in the CBSN Denver studio. Migraines affect 40 million Americans, yet it's a disease that is often overlooked and misunderstood. Joining me now is Dr. Ravi Shah, founder of Neurology of the Rockies. Dr. Shah, thanks for being with us. Now, most people think of migraines as just a bad headache, but it's so much more than that. I know that firsthand. What do you want people to know about this disease?
Yeah, as you said, it's very, misunderstood and very underdiagnosed. Migraine headaches are basically a very common neurological disorder that affect the brain and the nervous system. And it typically causes moderate to severe headaches that are typically worse with activity. About half of patients out there are actually undiagnosed, and a lot of people are just at home suffering. So I think it's very important. As you mentioned, it's extremely common. 40 million Americans and approximately 20% of women actually have migraine during their lifetime. So it's something that we have a lot of different treatment for. So I just urge people to get out there and get some help.
Absolutely. And we know that this is also part of your expertise, doctor. People who play contact sports are especially vulnerable to migraines. Why is that?
Well, a lot of people actually have exercise-induced headache. So when they exercise, they have an increase in their migraine. It's actually a common trigger. And I see a lot of, patients with concussion. And if you look at concussion, headache is a very common complication of concussion, so it can really worsen underlying headaches as well.
Do you treat like some of the Broncos players? I mean, we're just looking at videos. We know obviously a lot of NFL players get concussions, and they're clearly head-to-head with a lot of their contact. Is that something that you see or that is commonly treated among athletes like football players?
Yeah, absolutely. I'm the NFL consultant for the Broncos, so I take care of all of their head injuries. And the most common complication of concussion is headache. And so headaches are often a very tough symptom to treat. And most people with concussion that have lingering headaches, they have sort of migraine-like headaches. So it's very important to make sure we get them the appropriate treatment.
Absolutely. Now, as someone who suffers from migraines, I know that there are a variety of treatments out there. Do you have a preferred treatment, though?
Well, over the past couple of years, it's been huge in the migraine world to have multiple new medications that have been FDA approved for both migraine prevention and for the treatment of an acute attack. The most recent medication that came to market is called Nurtec ODT. It's an orally disintegrating tablet that you put underneath the tongue. It just melts in the mouth. No need for any kind of water. It's very effective. It works very quickly. And it's so well tolerated. It literally has a significant lack of side effects as compared to a lot of our older medications. And because it has a long half-life, which means it lasts a long time in the body, most people just need the one dose and they're good. And so it's an extremely effective medication.
Now, this is also a question that I'm very much interested in hearing your perspective. Migraine triggers. Everybody, I think, has different ones. There are some common ones. For me, I feel like it's weather-induced when there's a big weather change, which seems to happen all the time here in Colorado. So what recommendations do you have, doctor, for people and how they can better manage their migraine triggers and even recognize them?
Sure. There are some triggers that are manageable via lifestyle modification. So if you look at certain dietary triggers or hydration or getting a good night's rest, stress is a big trigger for people, but it's not as easy to manage that, especially during the pandemic. As you said, weather changes can be a big trigger, which actually happen very often here in our area, but that's not a trigger that it's easily to control, right? Because we don't have control over that. Although a lot of my migraine patients can actually predict the weather quite well. So I think it's important to look at that lifestyle and to know your migraine triggers and do the best that you can to sort of avoid those triggers.
I always say, oh, there must be a weather change coming. I can feel it in my head, Then I just consult our meteorologist and I'm like, what's happening? Should I pop my pills now? Well, Dr. Shah, we appreciate your insight, your information, and you just taking time to join us. We appreciate it so much. And for more information on migraines as well as Dr. Shah's practice, just head to cbsdenver.com.